good afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today are the Honourable Andrew Furey, Premier of Newfoundland and Labrador, who is joining us via Skype from Deer Lake, the Honourable John Haggie, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Of Newfoundland and Labrador's first COVID-19 briefing for 2021. I'm sure Minister Haggie will tell you the actual number of briefings this has been, but this is the first one for 2021. I have the pleasure of being in my beautiful district of Humber-Gross-Morin today, and that's the reason I'm not in the media center with Dr. Fitzgerald and Dr. Haggie. It's a new year, and many of us have eagerly awaited 2021. Well, now it's here. And with that comes new hope for our province and for the fight against the spread of COVID-19. On New Year's Eve, we saw the first batch of Moderna vaccine landing in the Happy Valley Goose Bay Airport for the Indigenous communities and remote areas of Labrador. COVID-19 vaccines have been continuously administered at the Health Science Centre to healthcare professionals throughout the Christmas season. More and more will come. Vaccinations will help the world look more like it did before COVID-19, although I think we all know things will never quite be the same. And we're not out of the woods just yet. While I hope you all enjoy a wonderful holiday season with your loved ones, even though it may have been a little different than our normal tradition. Mine certainly was. The large family gatherings we look forward to couldn't happen this year with COVID-19 restrictions in place. But it was wonderful nonetheless. I thoroughly enjoy time with close family. I'd also like to take a moment right now and address some questions that have been swirling around in the light of elected officials in other places traveling internationally over the holidays and even early. We've seen this across the country with some leaders traveling outside of the country. Well, rest assured, your government in Newfoundland and Labrador is leading by example. I know that many local businesses are hurting right now, and that many continue to make adjustments to weather this storm. Please hang in there, and please support your local businesses any way you can. Entrepreneurs and business owners are part of the backbone of this province. We all need to work together to keep the economy moving, even in the face of COVID-19. Thanks to the diligence of Newfoundlanders and Labradorians, respecting the advice of Dr. Fitzgerald, Minister Haggie, and all the public health officials, our numbers have luckily been low per capita. That doesn't mean we can let our guard down. That doesn't mean it's time to act like there is no COVID-19 in Newfoundland and Labrador. That doesn't mean we won't see a spike from holiday events due to the incubation period of the virus. Let's all hope everyone followed the rules collectively to protect Newfoundland and Labrador. Remember to pay attention to your mental health and that of the mental health of those around you. Be kind and patient to yourself and others. Enjoy healthy physical activity when you can, outside preferably, as that will do wonders for your own mental health as well. Reach out for help if you need it. Offer help if you see someone in need. Before I turn it over to Dr. Fitzgerald, I wanted to, of course, wish the best of luck to Alex and Dawson in their pursuit against Team Russia tonight. We will all be cheering loudly, some with masks on, some with masks off, for you in your pursuit. Go Canada, go. And with that, I will turn it over to Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone, and thank you for joining us today. Since the media advisory yesterday, we have one new case of COVID-19 in the province. The new case is a male between the ages of 20 and 39 in the Central Health region, and it is travel-related. Contact tracing is underway, and anyone who is a close contact will be advised to quarantine. The total number of cases in our province is 391. 374 people have now recovered, with 10 active cases. In total, we have tested 73,282 people. As the new year begins, we said goodbye to a year that was unlike any other. And while COVID-19 is unfortunately still with us, I am boosted by the optimism that comes with new beginnings and the possibilities that lie before us. 2020 had a profound impact on us all. Reflecting on the past year and how we dealt with this virus together, we need to remember the important lessons that came with it. For many, it brought into focus the little things that we took for granted. It made us slow down. It also exposed our vulnerabilities, whether they be personal or societal. These were challenges that required us to work together, and we did. We were reminded of the importance of being kind to one another and helping to support each other. If we take these lessons forward into this new year, I have no doubt we can make 2021 a remarkable year. We did so well as a province, and that is in no doubt related to this provincial community that we call home. We showed that we cared for one another and we put others ahead of ourselves. That this is a difficult thing to do, especially when we all just want to get back to normal. I thank you for your efforts. You have done exceptionally well. Our success as a province is due to our collective efforts and perseverance, and I know it has not been easy. In fact, it has been very difficult for many who make their living away from this province. We are the envy of many places. Everyone should take a moment to reflect what we have achieved since this virus came to our shores in March. And while we are in a much better position than many other places in terms of our COVID-19 case count, remember that this virus has a 14-day incubation period. This means that we will only begin to see the impact the Christmas and holiday season may have had here and across the country in the coming days. So if you have not yet downloaded the COVID Alert app, please consider doing so. It's another tool to limit the spread of this virus. It helps to protect you and your loved ones by letting app users know of possible exposures before any symptoms occur. We are fortunate, but we must also remember that this virus is stealthy, and even when we do everything right, it can still take hold. This is why we must remain vigilant and keep in mind that winter has really just begun. Continue to follow our tried and true public health guidance by keeping your close, consistent contacts to 20 or less. Maintain your physical distancing, wear a mask, and wash your hands frequently and effectively. Importantly, please stay home if you are unwell and call 811 if you have any symptoms of COVID. I must stress once again the importance of getting tested, even if you have mild symptoms. This is especially true for those who have traveled outside the province, but is equally as important for those who have had contact with travelers, and even for those who don't think they have been exposed to COVID. There are many people over the course of the pandemic who were quite surprised when they tested positive for COVID because they did not realize they had been exposed until the investigation revealed it to be so. We ended the year with a vaccine rolling out just before Christmas in St. John's and more to begin in Labrador in the coming days. This is certainly reason to be optimistic. A year from now, I hope we can look back and remember that in spite of the adversity and pressure that we all faced, we came forward braver, kinder, and more prepared to face the challenges that lie before us. As a recap, for those who may have just joined, we have one new case since yesterday's media advisory, and the total number of cases in the province is 391. It's a new year, and we have a blank page before us. Let's write this one together and make this a year one that we are proud to remember. Hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. I'll now turn it over to Minister Haggie for some comments.
Thank you very much, Premier. Happy New Year, everybody. We have vaccine day 20 of our rollout today, or as some wit in the department said to me today, it is now March the 303rd. This has been a long run, and we are in a good place to start 2021. The run-up to the year has been good, and people have once again heeded Dr. Fitzgerald's advice and listened. Our grade, as it were, for how well we did over the holiday period is, however, unclear yet and will come over the next 10 to 14 days. Our vaccine is rolling out, and I think it would be only fair at the moment to point out a little bit of what Dr. Fitzgerald said, which is we're not sure, nobody is, as to what effect this vaccine will have on transmission of the virus. So until there is a significant amount of immunity in a large number of people, public health measures such as the ones you've heard us all repeat regularly, and probably you're fed up with hearing them, but the fact of the case is we need to continue with distancing, and we need to wear masks and observe good cough and sneeze etiquette and use hand sanitizer or soap and water. Those things will have to stay with us, possibly right through into 2022, no matter how effective the vaccine is. The supplies of vaccine are our concern. We have guarantees of delivery now from Pfizer out to the beginning of February, and for Moderna until the third week of January. So we're in a good spot as far as that is concerned. It will take longer than everybody, including Dr. Fitzgerald and myself, want. But that is the way the vaccine is allocated, and that is Canada's supply and our share of it. So again, I reiterate Dr. Fitzgerald's comments that we need to hold the line, we need to hold fast, and this year starts with a great deal of optimism. So with that, Premier, I'll turn it back to yourself for closing comments.
Thank you, Minister Haggie. I'd love to close here, but I think we have to open it up to the media for some questions first. I'll open it up to comments and questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Thank you. I'm wondering if you can give me an idea, what's the total number of people that we've vaccinated, and how many vaccines do we have sitting in freezers right now that are still waiting to go into people's arms?
Good question. As of this morning, we have vaccinated 1,785 people. I have heard anecdotally we've done another 20 this morning, and that would leave about 140 scheduled to be delivered over the next day or so.
And so that means there's only 140 vaccines in freezers right now?
No.
Or
sorry, you're right. There is a second lot of 1,950 doses. Those will be given out next week as second doses for those people who started their vaccination prior to Christmas.
And other provinces have decided to just focus on getting everyone with a single shot and then delay the second shot in order to vaccinate more people and give more people at least good coverage, if not excellent long-term coverage. Is that under consideration here? And if not, why not?
So certainly that has been considered by some, and those discussions are happening. It is certainly something that we are talking about, but we haven't decided firmly yet. Certainly, we understand the importance of a two-dose system for the vaccine, and so we want to make sure we stay as close to that as we possibly can to ensure the effectiveness of the vaccine in the end. But the evidence is evolving, the science is evolving, and as we get new information that may change what our strategy is, we'll certainly have to take that into consideration.
Thank you.
Our next questions are from Allison King with VOCM. Please go ahead.
Hi, I'm just wondering if you guys are aware of any Newfoundlanders and Labradorians who are making vacation plans down south, and further to that, what would public health advice be on travel outside of the country right now?
Any travel internationally that's not essential at this point is not recommended, and that's everywhere in the country. It's certainly, we would say, any travel outside the province that's not essential, is not recommended at this time. I don't think people are sharing their vacation plans with me or anyone here at the Department of Health, so I'm not aware of anyone who's planning to go.
All right. And can we get an update on the Moderna vaccines that were shipped to Labrador? Have they made it to the North Coast yet, and when will they actually start rolling out?
Nunatsiavut have a plan to start using their share on January the 11th. They have jurisdiction in the Nunatsiavut territory, as it were. They've taken up public health and provide it locally. The Mushwa Innu First Nation are currently trying to come to the conclusion as to when they would like to deliver their supplies to their community in Natwashish, and we're in discussions with them at the moment. But yes, the first delivery of doses has arrived in Goose Bay and is currently at the depot there.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Minister Haggie, you noted the number of people who had been vaccinated as of this morning. Are those all primary health care workers or those who would work directly with COVID units, or are we still waiting on some who were on vacation to be vaccinated?
Those are principally staff on the COVID unit and those in high-risk areas within Eastern Health. The remainder are people who work there, but for various reasons have not been able to get in to get their vaccine. So at the moment, we have confined that first tray to healthcare workers, and that was really done because of the constraints that Pfizer put on us about not being able to move the vaccine once it arrived in St. John's at the Health Science Centre.
Thank you. And Dr. Fitzgerald, in response or in follow to Peter's question there in regards to delaying a second dose. With Pfizer, I think the last time I'd heard is that you have 3 days after those 21 days. With Moderna, it's up to 5. What happens past that time frame? Do the effects of the first dose no longer hold, or what do we know about that first dose?
So those recommendations have been made just because that's what the clinical trial data had shown, right? So there was Pfizer, made that recommendation at day 21 based on the information that they had. Certainly we know with vaccines in general, and we don't have experience with the Pfizer vaccine out beyond, very far to really be able to say for sure what happens. But what we know about vaccines in general is that even if the second dose or the booster dose is delayed, you still can get a good immune response from that. So certainly we would not expect that, the science would be any different with this vaccine.
Thank you.
Our next questions are from Barb Sweet with The Telegram. Please go ahead.
Barb, I think you're on mute.
Barb, are you there? Do you have yourself on mute, possibly?
I'll take this one, Minister.
Last call for Barb, and then we'll move on and come back to her. Barb, are you there? Okay, we'll come back to Barb. Our next questions are from Elizabeth Witt with All Newfoundland Labrador. Please go ahead.
Thank you. I was wondering if we could get any update from the vaccine committee on the logistical planning of the vaccine rollout.
The vaccine committee met just before Christmas and will probably be meeting again this week. The focus of our efforts had been discussions with the Indigenous groups, both in Labrador and on the island, and the focus has been very much on those isolated fly-in and fly-out communities. As the vaccine starts to roll in with further deliveries next week and into January, what we're looking to there is to have the vaccine, the Pfizer vaccine, certainly delivered to other vaccine depots across the province. When that happens, we'll be in a position to look at vaccinating essential high-risk healthcare workers in those areas, and then we'll be working on trying to make sure we can get to our vulnerable folk in long-term care. That latter at the moment for the Pfizer vaccine is a challenge because essentially Pfizer have said you've got to bring the individual to the vaccine, and that certainly would be a real challenge for people in long-term care. We're hoping that there'll be some leeway around that and some changes possibly in the light of discussions going on at the national level with Pfizer themselves. The Moderna vaccine, essentially, the first deliveries will be pretty well taken up by the Indigenous communities. So those plans are operationalized through the Indigenous groups, but in terms of the essential workers, those plans are ready for each of the regional health authorities, and we're just simply waiting on vaccine.
Excellent. And I'm curious if you can give a few more details, or if there's more decisions being made about who are the next priority groups to get vaccinated.
So certainly those priority group discussions are ongoing. Right now in Q1, we're really focusing on those 4 groups that we've talked about before, the essential healthcare workers, people in long-term care facilities, Indigenous communities, and those who are older. So certainly over the age of 80. Here in the province. After that, there are other considerations that we have to do. We're still having discussions about that, so I certainly wouldn't want to speak prematurely.
We're following closely the NACI guidelines, the National Advisory Committee on Immunisations. They categorised 6 groups in terms of priority. And our aim, as Dr. Fitzgerald says, is to work through Group 1. If you want to see what those other groups are, then that document will give you the more granular detail. But it's people such as incongruent living arrangements, and then at some point later on, we work our way down to what's often called the general public.
Thank you.
Our next questions are for Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. I just want to check in. Are we still expecting 2,400 doses of the Moderna vaccine?
Yes.
For next week? Yes.
Yeah, we're expecting. We have 2,400 doses delivered already, which will deal with, we think, numerically, the high-risk fly-in, fly-out communities of the North Coast and the First Nations in Labrador. We will be getting 2 more shipments in January the 6th and the 10th, and then 2 more right through to the end of January.
Okay, and do we know, will each of those shipments be another 2,400 or are numbers uncertain?
The numbers vary. I'd have to get those broken down by week to be precise, but they do vary delivery to delivery.
Okay, excellent. Thank you.
Our next questions are from Barb Sweet with the Telegram. Please go ahead. We thought we had Barb.
Hello?
Oh, Barb, there you are. Okay, go ahead.
Sorry about that. Technical difficulties my phone. Yes, good afternoon. And can you tell me what your thinking is now about the Atlantic bubble and whether that might resume?
Well, we discussed the Atlantic bubble. I think it was December 7th. We made the extension for a month. So we're still evaluating the epidemiology in the adjacent jurisdictions, and we'll make a decision over the next coming days.
Okay, thank you. And maybe perhaps if you could run through a little bit more detail on when most people might see the vaccine. I know it was later in the year, but is there any change to that recently?
No, not at this point. Certainly, it will likely be into Q3 for sure before we can start offering the vaccine to, we'll say, the general public.
Thank you.
Our next questions are for Peter Cowan with CBC. Please go ahead.
Premier, you said your government is leading by example when it comes to international travel. Can you just be more specific on that? Have any MHAs, to your knowledge, traveled internationally since the legislature broke?
Not to my knowledge, no, Peter. And certainly the instruction was given to Cabinet and to the Liberal caucus not to, so not to my knowledge.
We've seen the federal government announce that anyone entering Canada is going to need to show a negative test, even though just 2% of the cases nationally are from importation. In this province, the majority of the cases are from people traveling. So are we considering doing something similar here? And why or why not?
At this point, no, we're not considering having people get tested prior to coming into the province. Certainly right now, the system that we have in place is working, and we are detecting, we are testing certain groups and people who are at higher risk, certainly. And so at the moment, no, we're not considering adding that for travel. I mean, international travelers will be tested who come to the province because of the federal regulation, but not for people coming domestically.
Thank you.
I think it's just worth, Peter, reflecting on how this, Dr. Fitzgerald is being a little humble. Her rules have worked, and they continue to work. And, I don't know why we would tinker with a system that is currently working very well and is the envy of the rest of the country. Some of those rules in different jurisdictions have different epidemiologies, as we all know, but they didn't have the strict guidelines that we had in place from the beginning, and I think we need to continue on the current course.
Our next questions are from Allison King with VOCM. Please go ahead.
Hi, the CDC recommends that teachers be moved way up on the priority list for the vaccine. Where do teachers stand in NL right now, and what is the government planning on following any of those CDC recommendations?
So the CDC are in the U.S., and certainly, we have to look at the epidemiology where that is being made, that recommendation is being made. So we follow the Public Health Agency of Canada's and the National Advisory Committee on Immunizations recommendations when it comes to priority groups. All of those discussions are still happening. So again, I wouldn't want to speak prematurely before we have completed all of those discussions.
Okay, thank you. And this may follow under that as well, but in terms of like a mass vaccination stage rollout, is government even considering that process and how that process will work yet, or more so on the priority groups?
We have our arrangements ready for when we can move into that group. In actual fact, we ran it with the influenza vaccine this year. People noticed that there was a significant change in the way you did it. It was done by appointment. You could self-book. For those people who didn't have internet access, there was a call center who could enter the data for you and provide you with that information. We've done very well with our vaccine delivery in that regard. And prior to the new year, we had over 53% of Newfoundlanders and Labradorians having had their flu shots. I don't have any up-to-date statistics there, But that's the long answer. But the short answer is yes, that system is ready, and we can put it into play as soon as we get to that stage and as soon as we have the vaccines to do it.
Great, thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Knowing that most of our cases are importation from travel, are we looking to move rotational workers higher up into the priority listing for vaccination?
Yeah, so we've had, as I've said before, we've had, we're having conversations about that now, and all of these questions are being considered. And, but again, I, can't speak prematurely about that.
Thank you. And Premier, in noting that the Liberal caucus here was advised for no international travel, what do you make of some of your counterparts across the country who may not have heeded that advice?
I'm not going to comment on other jurisdictions. I'm quite proud of the way that Newfoundlanders and Labradorians have responded to Dr. Fitzgerald and Minister Haggie's advice, and I don't think it would be fair for me to comment on other people's jurisdictions.
Thank you.
Our next questions are from Barb Sweet with The Telegram. Please go ahead.
Hello. Yes. What's the very latest information you're getting about the COVID-19 variant and how that might impact the province?
So certainly we know that we have the variant here in the country. We've had a few cases that have been identified. We know that this variant appears to be more easily transmissible from person to person. And but it doesn't, at this point we don't know if it causes more severe disease, although indications are that it doesn't. It does not appear that it will be affected, or that it will affect vaccine effectiveness. So it appears that the vaccine will still work against it, and at least with the information that we have right now. And we will still be able to detect it with our testing methods. So, obviously this is not surprising. Viruses can mutate, and especially RNA viruses like this one. That's not unexpected at all. And so, I think it brings into, it reinforces the importance of all of those public health measures that we've talked about so much before now, is making sure that, you maintain physical distancing, wear your mask when you're out in indoor public places, wash your hands frequently, stay home if you're unwell. These are all very important to reduce the spread of this virus.
Thank you. And in light of that, I mean, how worried are you that this you could see more variants, or that future variants, I guess, could not be as effective with the vaccine? How much thought have you given that possibility?
So I think, certainly that's something that we always think about with any of these viruses. And, I guess we'll have to deal with that when it comes. If we have a variant that's not, that the vaccine doesn't work as well against, we have new technology now that's available for vaccine development that will help us to be able to shape a vaccine that may be more effective against that variant. Just like we have a flu shot that has 4 variations of the flu in it, we can have a COVID vaccine that has more than one variation of COVID in it, for example. But again, it goes back to, we know the things that we have to do to keep this virus at bay and to keep it from spreading. So those are the things that we have to focus on.
Thank you very much.
Our next questions are from Elizabeth Witt with All Newfoundland Labrador. Please go ahead.
Thank you. Dr. Fitzgerald, earlier you mentioned the COVID-19 app, and I'm curious, what's been the uptake of the app in this province since it was released?
I actually don't know, Minister, if you have that information, but I don't have that. I apologize.
There's no way to know.
No, because of the way the app was designed and because of the way it's built, we just have national numbers. I don't have the latest. I do know that early in December we were up to the 5 million mark, but there's no way of breaking it down by province or territory.
Thank you. And I'm curious, with the vaccines being rolled out and we have the tentative schedule for when the general public might also get vaccinated, I'm wondering, when could we go down to alert level 1, or is that even on the table?
So alert level 1 really depends a lot on what we see what we see happening elsewhere in the country and around the world, really, with regard to COVID-19 transmission. And if we're still seeing COVID transmission as we are right now, it'll be very difficult to move to alert level 1, where we would be considering that travel might be, travel to certain areas may be acceptable, that sort of thing. It's not really something that's doable at this point. Certainly, we've always said that in order to get community immunity, we need to see at least an 80% or more uptake of that vaccine. And so it's very important that we need to see that, not just here, but be nice if we could see it elsewhere. We may not need to see it elsewhere to move out of the alert level system, but certainly we want to make sure that the rest of the world has good vaccination rates as well.
Thank you. Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. I'm wondering, what does it mean to have now the Moderna vaccine in Labrador and ready to, ostensibly ready to head out to the vulnerable remote communities along the North Coast?
Well, I think
this is huge. Sorry, Minister, you go ahead.
No.
This is a gigantic win for Labrador and for the Indigenous communities. We know Indigenous communities are at-risk populations for multiple reasons. We know that the remoteness of these isolated communities is a challenge operationally, and to have the Moderna vaccine with the distribution units on the ground in Labrador is a reason for significant hope and optimism for our Indigenous communities on the coast of Labrador. It's huge.
Thank you.
Do you have a follow-up, Sarah?
No, I'm okay. Thank you very much.
All right. I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do. This one is for the Health Minister. I just want to pick up on something you said in your preamble there, that we may be dealing with restrictions into 2022. Kind of a sobering thought in a year that's supposed to have some optimism. How likely do you think that there may still be, for example, things like travel restrictions in place for another whole year?
I think it's very much dependent on the rapidity with which we can get people vaccinated and what happens in other jurisdictions. We currently have a vaccine, one which is very difficult to move around and has significant challenges in administration. We now have a second one, which is way more flexible and is available for fly-in and isolated communities. There is a third vaccine which has been approved in the UK, AstraZeneca, which is very much of the traditional mold of a vaccine, which is requires very little in the way of special storage. It's handled in the same way it would be a flu vaccine. If that gets through the approval process here, and if we can get adequate doses of that, then that will obviously speed the process up. I mean, my understanding is that Canada has ordered somewhere in the region of 4 times the amount of doses that it would require to vaccinate every Canadian. And so at some point, we're going to have, hopefully, a significant supply of vaccine. And that will determine how rapidly we can get people vaccinated. The next piece then, locally, is uptake. Because if the uptake is poor and the virus is still in circulation, the only thing we've got to rely on then is public health measures. And as the Premier and Dr. Fitzgerald have said, amongst those and foremost amongst those has been our travel restrictions. And that's presented benefits, but it's presented significant challenges. So again, you hope for the best and plan for the worst.
Allison King with VOCM, do you have a final question?
Yes. I'm just wondering how many ultra-low freezers do we have in the province right now, and in what regions of the province, and how many more are on the way?
We have 2 at Memorial University, 1 at Eastern Health, 1 in Central, and 1 in Happy Valley Goose Bay. There are another 2 coming from the feds, and they should be here this week. And there are another 5 on order, which should be here over the next 2 or 3 weeks. There is also a freezer in Corner Brook, which was donated by Fisheries. Unfortunately, it needs some maintenance work, so it's not up and running at the moment.
Okay, thank you.
Kellyanne Roberts with NTV, do you have a final question?
Yes. Are we still remaining at 3 briefings weekly, or is that changing as we've entered 2021?
We'll continue at 3 briefings for the first few weeks and see how the numbers go, and judge accordingly and make changes from there.
Thank you.
Barb Sweet with the Telegram, do you have a final question? Hi, Barb. Barb, are you there? Unfortunately, might have lost Barb again. I'll move on. Elizabeth Whitten, All Newfoundland and Labrador. Do you have a final question?
No, I'm good.
Thank you. Sarah Smelly with Canadian Press. Do you have a final question?
I'm good, thank you.
Thank you. I'll try Barb one
Hello?
last time. Barb, are you there? Yes. I can hear you.
Yes,
Do you
sorry
have a
about
final
that.
question there?
Yes, and I apologize if this question has already been asked previously. But the 3 of you, I assume, have you had the vaccine? And if not, when would you be in the queue for it?
I have not, and I'll be in the queue when my profile is appropriate, which would be presumably when the rest of the general public and an otherwise healthy 45-year-old male becomes available, which would probably be in Q3, 4-ish, I would think.
Yep. And
I'm assuming that neither one of you have had it, but
no,
we're not on the front line, so to speak.
No, we're not. Certainly not in those initial priority groups at this point. Certain public health teams that are working on the front lines have been vaccinated, but our public health team at the department is not on the front line. So we are back with other healthcare workers, I guess.
And Barb, that's not to say that we don't have confidence in the vaccine. Of course, my wife has had the vaccine as a frontline COVID worker, and I've got the utmost faith and confidence in the science and the rigorous process that these companies have gone through to seek approval and get approval. So we're very confident in the vaccine. It's just that we're not on the front lines and we don't need any of those vulnerable groups, and those are who need it first.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Thanks so much for joining today. It's a new year. There's definite reason for hope and optimism in 2021. We're talking about vaccines. I mean, we are talking about vaccines ahead of schedule, but we're also talking about low numbers. And I think that's a credit to each and every Newfoundlander and Labrador and sacrifice that you have all made, and especially during a trying holiday season. Once again, please look after yourselves and each other. Support local businesses when you can. They're the backbone of our economy, and they need our support now more than ever before. And I'm sure you all join me in wishing Dawson and Alex the best of luck. And despite our masks, our enthusiasm and cheers will not be muted as we cheer them on from home. We're all very proud of you guys. Keep up the solid work.
Thank you, Premier. Take care, everyone. Stay safe and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work.
Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.